All right, Siham, we're in the green. It's recording. All good to go.
All right. Hello, everyone. Just for transparency, this panel discussion is being recorded for rebroadcasting via social media and also other mediums. Good afternoon and welcome. My name is Siham Jafer, and I'll be moderating tonight's discussion. Welcome to the Dearborn Lions Club COVID-19 Coronavirus Panel in partnership with DMC and Access, focusing on preventative care, mental health, COVID-19 effects on children, the vaccine, and the future of eradicating this horrible pandemic from our communities and our families. I'd like to introduce the president of the Dearborn Lions Club, Lion Ali, to get us started this evening. Ali, can you say a few words for us?
I will. Good evening, everyone. So thank you, Siham. I'm gonna keep it nice and short so we get started right away. Today we have a COVID-19 health and safety panel brought to you by the Dearborn Lions Club in partnership with the Detroit Medical Center and Access. The purpose of the panel is to make sure you all have the correct factual information to make the right health-informed choices. And so in today's webinar, we'll have a focused discussion on the impacts that COVID-19 has had on youth and adults, coping strategies for stress, anxiety caused by COVID-19, and vaccination information. Also, I want to thank the Dearborn Lions Club members for supporting this effort: Jamal Dakrub, Fatma Mustafa, Fuad Ashkar, Samir Alabi, Ronald Coleman, and of course, Siham Jaffa. I would like to also thank the DMC, and in particular, Tanita, for supporting this effort throughout, and Access as well for the amazing work they have been doing in providing vaccines and leading COVID-19 support efforts in the community. Thanks to all the panelists, Dr. Dakrub, Dr. Amran, Dr. Harsuni, and Mona Maki for being present today and sharing helpful information on COVID-19 with us all. With that being said, I encourage you all to submit questions throughout the panel using the Q&A option at the bottom of your Zoom window. And towards the end of the panel, we'll be presenting some questions to the panelists. And with that being said, Siham, I'll turn it back to you.
All right, thank you so much, Ali. I'd like to now ask DMC's Chief Community Engagement Officer, the amazing Tanita Chapman, to say a few words on behalf of our Detroit Medical Center partnership. Tanita?
First of all, thank you so much. Thank you so much to this esteemed panel, to the Dearborn Lions Club, Access, the Detroit Medical Center. More than just a healthcare institution, we believe that healthcare starts in the community. There are a lot of steps when you get sick at home between you being at home sick and you end up in a hospital. And so we are always honored when we have these opportunities to step beyond the walls of our institution into community in a virtual space as well as in person to present our medical experts who love doing this kind of thing. We're in the middle of a most interesting pandemic. Certainly nothing like this in our lifetime has happened. And so when the question is asked, what can you do? Well, everybody has a part to do. And so part of what we do at the DMC is not just take care of patients in the hospital, but provide medical experts in opportunities like this or spaces like this where we can have living room conversation, meaning people feel comfortable asking their questions. And our experts are here to answer them. So thank you. We're grateful to be here. We appreciate being representative, and please invite us again.
Absolutely. Thank you so much, Tanita. I'd like to briefly introduce our esteemed panelists and thank them for investing their time and expertise and joining us for this crucial conversation. First and foremost, I'd like to thank and introduce Dr. Hassan Dakrub, who is an infectious disease specialist in the Beaumont Healthcare System and brings over 20 years of experience in infectious disease. So we're looking forward to hearing from you. She's an internal medical practitioner at the DMC. Dr. Amal Omran uses scientific knowledge and clinical expertise to diagnose and treat acute and chronic medical conditions. Dr. Omran has a special interest in managing complex cases, including multiple types of sleep disorders, which we'll talk about as well. So welcome, Dr. Omran. Mona Maki is a clinical psychologist and the director of the Community Health and Research Center at Access. She's been on the forefront and on the front lines during the COVID-19 testing phase, as well as the vaccine distribution phase. She's a mental health professional and has addressed the repercussions of this statewide shutdown, the fear association with living with this pandemic, and the effects it has on our mental health and well-being. Welcome, Mona Maki. Dr. Radha Harsuni is an academic pediatrician at DMC. She will shed light on how children have been impacted by this COVID-19 virus and how they've reacted to the pandemic and vaccines, and how they may play a role in may or may not play a role in keeping them safe. So welcome, panelists. Thank you for joining us. So Dr. DeKroob, I'd like to address the first question to you. As an infectious disease specialist, can you shed some light on the mitigation of this pandemic, the vaccine's role, and the issue of herd immunity? And I'd also like you to shed some light on the reality of our situation right now. Where are we in mitigating the process? And why is Michigan on the upper end of these cases, every day reporting additional cases? That's a mouthful, but I know that you can address it.
All right. First of all, thank you for having me, and thanks for all your panelists. Here's the thing I want to say about COVID-19. COVID-19 has been a learning curve for all of us. You know, when this thing started approximately like 16, 17 months ago, you know, we had no idea what we're dealing with. So we were trying to, you know, act quickly to save lives. At the same time, we were learning, you know, as we go. I've been on COVID units when this thing started back in December of 2020, and this all, you know, I'm sorry, not December 2019, and this has all been, you know, ongoing since then. So up to now, we had like 3 waves. So wave 1, I'm talking about the Beaumont healthcare system because this is the one where I practice. So far we had 3 waves: wave 1, wave 2, and now we're in wave 3. So wave 1 was devastating. We had little knowledge to go by, you know, everything was in shortage, you know, personal protective equipment, medication, you name it, it was all, you know, in shortage. Wave 2 was less deadly. I mean that we knew more how to deal with COVID. The medications were available, more PPEs were available, all this good stuff. And we were able to act fast and save a lot of lives. And now we're in the middle of wave 3. While the vaccine is being rolled. Most of the vaccine is, you know, when it started, the distribution started very slow. It was only for older people. We started for 65 and above. Then we said no, 55. Then we said no, 50. And then, you know, they're trying to open it. They open it now from 16 and up. But the problem with the vaccination in the United States of America, the vaccination rolling was very slow. And that's kind of affected it. The only way I can tell you after a year and a half working on COVID units, the only way to get through this pandemic is through vaccination and vaccination alone. Now, nothing's gonna help us at this point in time, no medication like remdesivir or Toscilusimab or the stuff that we use, we have only minimal effect on what we're doing. And unfortunately, in some cases, they have detrimental effect. We need everybody vaccinated. That's something I'd like to start with. You know, everybody has to be vaccinated. Now, the different vaccines that are available, being Pfizer, being, you know, Moderna or Johnson & Johnson that are available, they work. Of course, each one has its, you know, ups and downs, its side effects and stuff like that. Like, for example, Johnson & Johnson, as you know, was, you know, taken off or stopped for a minute. Then they reintroduced it and said, yeah, hey, you know what, you can use it again. But unfortunately, they reintroduced it without telling us what's the criteria. Why you removed it and why you reintroduced it. You said, okay, causes cavernous sinus thrombosis, but then you put it back again and said, yeah, you can use it. But did you give us any criteria? No, they did not. So during this discussion, I will clarify some stuff about, you know, Johnson & Johnson so that, you know, the people that are watching can benefit and, you know, try and have some guidelines with it. Now, as far as why Michigan, go ahead.
Dr. before you go on to that, you mentioned remdesivir and some other anecdotes. The new method of using antibodies. I've heard that is something that's a treatment. Is that effective, or is that just something sort of to hold the communities together?
I will run through all the methods of treatment that are available quickly so that, you know, we don't waste time. So you got the plasma, you know, therapy that are given, which is proven to be ineffective. So that's something that using it or not versus not using it. There was a big study in New England Journal of Medicine that showed that plasma therapy does not work. Now you got the monoclonal antibody, which is unfortunately only is an outpatient setting, and you have to use it and use it very early. It's not available in hospital use. I mean, some people come to the hospital to get it as an outpatient, but this is why people are confusing it. Oh, I can go to the hospital and get monoclonal antibody. This is only as outpatient, being run through infusion services, or, you know, or like ER that have some, you know, sort of infusion protocol to give the monoclonal antibody. So that's put aside. This is only an outpatient setting and very early on. If you leave it to later, it's not going to work, period. You know, there is remdesivir, which is the other one, which is, you know, Pfizer drug, that we use it for the treatment of COVID-19, which, you know, after a year and a half working and, you know, on the units and giving it and stuff like that, it's not very effective. Okay, it's not as effective as we want it to be, and has some side effects, and I had to stop it multiple times because of bradycardia, which is, you know, low heart rate. So people getting low heart rate, so we have to stop the medication and then just watch them without the medication. There is Decadron, which has been shown to be effective, and it does play a role, but again, some people do progress to worse, even though they're on high dose of Decadron. And then there is Toscilusimab, which is an IL-6 inhibitor. It's an interleukin-6 inhibitor. It's meant to stop the cycle, you know, of progression of the patient. But unfortunately, the use of Toscilusimab, even that, has caused some severe infection. Being an anti-IL-6 inhibitor, you're playing with immunomodulators, and that can cause a lot of infections. So we really be between a rock and a hard place, you know, with the treatment of COVID-19.
So basically what I'm hearing you say is that vaccine is really—
That's exactly right. We got to vaccinate, and we have to be smart about vaccination and who gets the vaccination, because we've been dealing with side effects of vaccination. I've been dealing with this stuff ever since they started rolling vaccination, whether it's rashes, whether it's, you know, palsies like, you know, cranial nerve number 7 palsy, which is Bell's palsy, whether it's people who's having severe side effects, whether it is, you know, some people who's having you know, thrombocytopenias, you know, low platelets. So we're dealing with it. It's not too much, but it's out there. So we need to know about it. Like, for example, in case of Johnson & Johnson, you know, they stopped giving Johnson & Johnson because of the presence of blood clot, mainly in women. Okay, so most of the cases that had blood clot, cavernous sinus thrombosis, which is the venous sinus of the brain, it's a system of the brain that is causing it to thrombose. So now they rolled it back and said, yeah, you know, you guys can have it back. But I can tell you from the studies that I've done, from the things that I've read, women should not have it. Women, period, should not have Johnson & Johnson vaccine because of the risk of cavernous sinus. Now,
that would definitely make sense. I think, you know,
right.
Eliminating the gender issue in regards to the effects makes
exactly
sense.
Right.
So definitely.
Now, some people say there's only a couple of cases. Oh, why are you making such a big deal out of it? Any loss of life is a loss of life for me. It doesn't really matter whether it's 1 person or 10 person. Something happened. We have to make sure to be proactive about it. So my advice, people who, you know, who get the Johnson & Johnson vaccine should have a CBC 5 to 7 days after getting the Johnson & Johnson to look at their platelet count. And at the same time, women should not get it. And at the same time, if you look at the mechanism why the Johnson & Johnson causing this cavernous sinus thrombosis, it's because it's attacking the platelets. And when it attacks the platelet, it fragments the platelet. And when it's fragment, other platelets come in clump. And that's what's causing this, you know, cavernous sinus thrombosis. And people are using heparin to treat that. I tell you from now, heparin should not be used at all. Period.
Absolutely.
When it comes to cavernous sinus thrombosis.
Absolutely. Words of wisdom. Absolutely. And talking and really addressing the sort of the elephant in the room, Dr. Amran, people are not going out there and they're not getting physicals. They're not paying attention to different health issues that they have, you know, cardiac, whatever it may be, for fear of going to the hospital and, you know, the issue of COVID being in the hospital. What are we seeing in regards to that, and how can we ensure individuals actually go in and get the treatment that they needed? How can we make them feel good about it and feel safe about going in?
Well, you know, thank you for having me first. And it's really nice to be all together discussing this critical issue right now going on in our life, which is COVID. Well, you know, taking the measures to prevent the COVID-19, which is following the CDC guideline by social distance and wearing the mask and having the good hygiene for the hand when they come to the clinic. That's very crucial. For example, we're really in the DMC clinic following that guideline. So we're telling our patient, you can always, it's not all about COVID-19 and the coronavirus. We got sick, we have asthma patient, we have heart attack patient, we have high blood pressure patient, chronic disease like diabetes. They have to go to their doctor, see their doctor on a regular basis. So just given the fact, if they consider that guideline, wearing their mask, they're gonna be just fine. We did not stop seeing our patient in a DMC clinic at all during even the scary peak of the COVID-19. We were physically seeing our patient, given the fact, as I mentioned, the preventive measure that we've taken in our clinic, that's make the case, okay? Telling our patient, wait in the car till you got your turn, we call you in and you come in. So just making sure the patient and the people around taking their precaution, wearing their mask, keeping the social distance, they're gonna just be being fine and come to the clinic. We can't stop seeing patients because of COVID. People got sick with another diseases, right? So, and now we're gonna see more cases of long-term complication of COVID-19, that's what we call it, the post-COVID-19 syndrome. And we're gonna see patients coming to the clinic. I mean, they can't stop not to coming to the clinic. Telemedicine definitely find an exit for the patient who's really scared, anxious of being in doctor's office, but still we need to examine the patient. So, I mean, that fear in the community that I don't want to go to the doctor, I think if they just follow the guideline, and we are following the guideline in our clinic as a provider and staff, they're going to be just fine.
Wonderful. So we want to encourage people to go in if they have underlying issues, that every precaution is being taken. Mona, Director Mona, you have been on the front lines and really spearheading a lot of the testing and the vaccine initiatives, along with your husband, Phil Levy. You two sort of the dynamo team in making this all sort of happen, especially in our area and in Michigan. Mental health has been affected extremely in a negative way regarding the shutdowns, the wearing the masks, having to social distance, not seeing family, being secluded. I had an individual I was talking to that was 78, 80 years old, and she is just very mentally fatigued regarding having to continue this process and the fear of COVID. What are we seeing in regards to the community and their challenges, and how is that posing a huge challenge for the mental health arena?
Yeah, thank you, Siham. As you mentioned, since the start of this pandemic, going back in March, just seeing what people were going through, even from the frontline healthcare workers early on when the pandemic hit, and the effect that it had on those folks mentally and their families. And it really, across the board, when I look at all age groups, this pandemic has really affected everyone, brought on a lot of stress, a lot of anxiety, depression. And when we look at, social distancing, while that was a requirement and put in place to remain safe, but also there's a consequence to that, right? So extended periods of loneliness in the long term affect mental health and physical health. It can deteriorate over time. And so if folks don't get help, there's that long-term impact that it has. So, we're seeing at Access a large number of folks calling in for services. I've already added 20 additional mental health professionals to an already very large team. So we are seeing thousands come in. And, today, all day I spent time on the phone with families of young children and how they are struggling and trying to, pay attention to their children. And I'm very proud of our community for stepping up because, you know, throughout the years, we've always had to deal with the shame and stigma around seeking help. But, you know, folks coming around and understanding that this pandemic has really affected everyone one way or the other. And there's normal, you know, some of this is normal. It's normal to feel, you know, stressed, and it's normal to feel some, you know, sadness and some depression and some fear. There's a lot of unknown still out there, but we also have to monitor this very, very closely at the same time. So, you know, a recent study that was posted by the CDC report of 5,400 people found that 25% of the respondents between the ages of 18 to 24 had contemplated suicide in the previous 30 days. So just now we are seeing the true impact, right? Because when we look at, you know, anxiety and depression, that's what we're seeing right now across the board. And you look at that over time, right? So, you know, again, everybody experiences some level in a pandemic, it's normal. But when this is persistent over time, it becomes a concern. Becomes a concern when it affects, you know, the daily routine, affects one's sleep, appetite, loss of interest in activities, not being able to connect or want to connect with others. So these are very concerning things. People expressing a lot with difficulty concentrating. We see this with the children, young children, with teens right now, having a real hard time with school. I actually want to read this letter that I just received that I was heartbreaking. This is a 9-year-old. Dear mommy, I'm sorry that my grades in school are going down. I'm getting lots of stress doing school right now. And she lists them: new math, tests, grades going down. Knowing that my grades are going down, it gives me more stress in school. I'm so sorry. Love you, mommy. Like, just so right now, we can't even talk about what the long-term mental health impact that the pandemic has had. You know, that's something we're going to see, you know, 5 years, 10 years from now. But right now we have to pay serious attention to this. And this is where community becomes so important, and the work that we are doing at Access and many, many amazing organizations and health systems out there, you know, providing opportunity for folks to get help. You know, recently the state just put out a memo, actually as of yesterday, for mental health providers to transition back to the office in a safe way, because there was a number of complaints of people reaching out, not being able to have that face-to-face interaction, not being able to connect and get the help that they need, because the remote, you know, worked for some, but for many, it did not work. So at Access, we are slowly now transitioning to be able to meet the needs and be able to interact and connect with people again. And that's very, very important. You know, I remember early on in my years when I used to practice and seeing, you know, people who were depressed, one of the things that we aimed for is getting them back into the community. You know, looking at their natural support system, you know, connections, and how important that is for overall mental health. So having a pandemic with these types of restrictions really affected folks in many, many ways.
Certainly it did. And I think what I've heard is that people need to reach out via phone, whatever it is, check on your family, the elders, seniors, whoever it is, but that interaction is truly vital, whether it's, you know, in person, a window chat, or you know, outside, anything that human interaction is so vital. And going into and thank you for reading that letter, Dr. Harsuni. There are so many issues surrounding children and just the uncertainty about what's happening in this pandemic regarding children. I know that it's been recommended that children 2 and over actually wear masks now. So what new research have we gotten and received to support that recommendation, and how are we keeping our children safe?
Right. Thank you for having me. I just want to start off by saying that there has been a myth that it doesn't affect kids. Kids don't get affected, but we are seeing the opposite of that. And in this third surge, we're seeing a large volume of patients in our children's hospital with especially Miss C. So MIS-C is basically a multi-inflammatory syndrome that we're seeing in children, and that's what the name is. And basically it can come 3 or 4 weeks after they get infected with COVID, and some of them can present asymptomatically, and then 3 weeks later they can be hit with this MIS-C, which is basically fever and like inflammation of multiple organs. A lot of them needing ventilators, ECMO. So it's pretty serious out there. So I really wanted to throw that message out there that we have to protect our children. But in terms of masks, yes, we have seen, of course, the transmission decreasing dramatically, with just practicing hand washing, wearing masks. It's very important to prevent the transmission, to prevent this virus from, going out there in the community. And obviously the vaccines are still right now in trial. Pfizer and Moderna right now are doing trials for kids as early as 6 months of age. So they're enrolling at different hospitals now, which is a light at the end of the tunnel for the children. And as you guys know, pediatricians, we push vaccines because we've seen a lot of diseases just no longer seen. Like in my training alone, there's so many diseases that I've only seen in textbooks. And so my wish is that COVID becomes something of a textbook, in maybe 10 years or even less than that. But in terms of wearing masks, my own kids right now are wearing masks, and I was so happy about this change last week because I was seriously advocating for that, because kids can wear masks. You just have to train them and teach them and just talk to them. And the most important thing is if you're showing them an example, if you're wearing a mask, kids learn by example. So that's something that you as a parent can do easily, just training your kids.
So Dr. Harsuni, I know that you're seeing these conditions in kids, but what are the signs that parents need to look for in regards to children contracting it? Because their symptoms may be different. And how serious is it in children?
Yeah, so just from like observance in the community, some people think that their kids don't have COVID just because they don't have fever, but kids can present with just a runny nose and have fever, just a runny nose, or just congestion, or just a cough, or just nausea, vomiting. So kids can definitely present differently than adults can. So it's important to do our part and test our kids, because the testing sites are actually very all over the place, really, here in Michigan. So if you have a kid with a runny nose, get him tested. If you can find out he has COVID, keep him away from daycare for that recommended 10 days, just to prevent the transmission. But also the MIS-C that I spoke about earlier, it can present weeks later after a COVID infection. And we can see kids having fever, and usually fever more than 3 days and not getting better, because most viral illnesses tend to get better by 72 hours. So if kids are not getting better by that time, and they're presenting with something like a rash, abdominal pain, lethargy, things like that, you have to start thinking about MIS-C and have a low threshold to take them to the ER, or just start off with a pediatrician and just make sure that they get tested if the doctor feels that they need to get tested for MIS-C, and that involves basic lab work that can be done at an ER setting.
So our comfort level in regards to children needs to be heightened quite a bit. And also, just as we had spoken with Dr. Aman earlier, it's important that parents get their children's vaccinations up to date as well. The rubella, the measles, so those things don't compound what we're dealing with. Dr. DeKroob, I want to come back to you. In terms of the vaccines now, 8% of the individuals who are getting vaccinated the first time are sort of choosing not to vaccinate the second time. So that I'm sure that that's having an effect. And in compounding that, we talked a little bit earlier, but the vaccines were developed fairly quickly. And I think the resistance is because, are they safe? Did all the science go into these vaccines correctly? And regarding the Johnson & Johnson issue, what do we say to people that are listening, and how do we approach this in a positive way where, the confidence level is still where it needs to be?
Well, first of all, let's see about the vaccination that has been developed quickly. First of all, the technology that they're using is not a new technology. It just was pushed a little bit quicker in order to, accommodate the new threat that we have. COVID-19 is a threat. It's a global threat. that affected everybody all around the world. And the technology was available and was available for years. Messenger RNAs has been used for a long period of time. It's not the first time we do something called a messenger RNA and we put it in a vaccine, but it was not used widely. It was only used in a very, very tight, circle and a very tight situations. So the technology was there. It's not that this is something new they did. Now the usage of, for example, in Johnson & Johnson of the adenovirus and the mechanism of removing its guts and putting the COVID-19 apparatus inside the adenovirus. This is something that I've been hearing of for the last 20 years. That's not something new about, manipulating viruses and injecting them and doing stuff like that. But when you're in a tight situation like that, it is, something we have to use in order to protect the population that are all around us. What's the alternative to the COVID vaccination? I tell you what's the alternative. Ventilators, bad, situations, death, or at least, that where we saw with the first wave, chronic renal failures, end-stage renal disease, dialysis, total lung failure when we have people, on the ventilators and they have pulmonary fibrosis where, the lungs turn into basically nothing, non-functioning, entity. So the alternative is very bad. We lost a lot of life, 500,000 just in the US a month ago or something like that. So the alternative to non-vaccinate, to not get vaccinated is really terrible. And if we want to talk about the wave that we are dealing with right now, most of the people that we're seeing are in between the age of 30 to like 60, and the average age is between 45 and 50. I have on my list at Beaumont Hospital, many people in their 40s and in their 50s that are on high flow oxygen. Why is it like that? Because these people didn't get a chance to get vaccinated, because these people did not get a chance to, get offered the vaccine. Nobody offered them the vaccine because it wasn't available and the priority was for the older adult. So that is something that's caused this, shift in the age. At the same time, the other reason why is that we're dealing with variants. Now the variants, the B117, which is the, UK variant, I see it in about 30 to 40% of the people that are infected right now. And you're dealing with people who, relaxed their measures, no social distancing, not wearing masks, stuff like that. And that's what caused them to get infected. So there's multiple reasons why people got infected and why this age group got affected more, than the other. Number one is not get vaccinated, or not, the vaccine was not available for them. Number two is the social distancing and the other message, other measures that they take, like, the masks, washing hands, stuff like that. And at the same time, the variant that has affected a whole lot of people. And don't forget, this variant make people sicker and infect at a higher rate. So that's why now we're in the middle of this surge.
So actually, many people think that they may be covered with the first vaccine. They need that second vaccine. And really, it's not about young, old, age. Everybody is affected here. So we all need to address that.
Let me tell you real quick about just little statistics with the vaccination. So if you take the first shot, you're protected about 50% after 2 weeks. If you take the second shot, you're protected around 95 to 97%, depend on what you take. And it depends on the latest statistics, about 2 weeks after you take the second shot. So it's definitely a must to have the second shot. Now, some people are saying if you already had COVID and you go and get vaccinated, this is a little bit of a confusion here. So if you say, if you had COVID and you go get vaccinated afterward, that one shot may be sufficient. And there's some studies, again, in JAMA, New England Journal of Medicine, that did show that it does protect. But again, there's no, how do I say it? There's no benefit from getting just one shot alone. We need to get both shots to get the full benefit of the vaccine.
Certainly. Thank you, Dr. DeCroop. Dr. Amran, I wanted to come to you for a little bit. I know that you specialize in sleep issues, and many individuals who have had COVID are complaining of the lack of sleep, insomnia, and sort of something that's called brain disease, because of having COVID. And again, Dr. DeCrube, this is a stipulation that people need to get vaccinated because we don't know how this disease is going to affect us long term. But what do you see in regards to that and this brain disease, brain fog kind of thing? Is that real, and are you seeing that?
Yes. Well, in my sleep clinic, I started seeing a lot of insomnia, okay, especially in the provider. They really affected badly with the COVID-19, the anxiety in provider and general population. Anxiety, background, depression, being isolated. Also, we're seeing some of the circadian rhythm disorder, which is delayed phase circadian rhythm, where we're not exposed to the sunlight in the morning. They isolated in the house. That's really interfere with their internal clock. Okay, so they're not going a regular like bedtime as before, being on the social media, hitting that button to see what the number right now, what the update about the vaccine. That's all contribute to that insomnia. So we're seeing insomnia, we're seeing anxiety, we're seeing post-stress traumatic syndrome, we're seeing nightmare. That's all. In children population, unfortunately, because of the COVID-19, I work in children's hospital. I did not have a chance to go back to the clinic, but definitely affecting kids. And I bet Dr. Harsuni, she knows about that. And being anxious about the parents, being anxious from the situation, homeschooling, it's all contribute to that anxiety. The anxiety itself lead to that insomnia, which we call it psychophysiological insomnia.
So it's more of the mental health aspect rather than the actual what the body is physically going through after having COVID.
Well, the COVID infection itself may interfere with the cytokine that's also predisposed to some sleep disorder. Okay, the infection itself, it may affect the sleep. Okay, because it's interfering with that internal clock. It's going to disrupt your sleep. Having the fever, the chronic fatigue syndrome we're seeing, muscles pain, headache, it's all contributing. You're not going to sleep well. And the apprehension from something going to happen, okay, being occupied with the consequences of the COVID-19 disease are going to affect their sleep. So that's all contribute to the insomnia.
Absolutely. So Director Mona, are you seeing these issues as well in regards to our senior population, the community? I mean, the sleep disorders, the physical attributes that come along with, the mental stress that people are experiencing.
Absolutely. Dr. Amran said it well. I mean, it's across the board. So what we recommend is that people reduce their time on, listening to the news, avoid, alcohol and substance use during this time, to monitor their sleep, to eat, healthy, well-balanced diets, again, exercise, yoga, meditation. And, the good thing right now is we're in springtime right now, so it's a good time for people to they can take walks. You can do stretches. You don't have to go to the gym. You don't have to do any excessive type of workout. So these are all things that are very, very important. Activities to engage in and to monitor their health and well-being. But you have people who are sitting hours on listening to the TV, listening to the news. And as you can see, there's a lot of misinformation out there, and it creates a lot of fear in people. And that's, again, when we talk about stress and we talk about, anxiety, we have to understand the difference. So stress is a response to, a threat or a situation, but anxiety is the reaction to the stress, right? And it can be, prolonged, and it can be chronic if not treated. So you want to be able to monitor that, and especially, again, with children, we're seeing, children on video games, even listening to the news themselves and asking questions and creating a lot of fear, and encouraging parents to be, honest with their children as they're communicating with them. And again, watching their sleep patterns, the amount of screen time, because with young children that could lead to cyberbullying as well. And we're seeing a lot of that. So, this is a time where we have to really monitor our health and the health of our well-being, whether that be physical, whether that be mental. We got to look at the environment. We got to remain safe. We have to continue with the precautions that are put in place because they have proven to keep us safe. And so this is kind of where we're at with educating the community on ways to stay safe and monitoring their health and well-being. And also a lot of times we get calls as to when do we seek help, you know, and that's where I was talking, Siham, about the extended period, right? So a lot of this is normal feelings to a pandemic or to experience any traumatic event or unfortunate situation. But if it's persistent over time, you know, withdrawing and not wanting to engage in activity, persistent sadness, feelings of helplessness and hopelessness. And we touched a little bit about suicide, but we're seeing that right now within our own age group at Access 14 to 18, we had 5 suicide attempts in the last 2 months. And I will tell you, I was on the phone today working with another family. I mean, we really got to pay attention to this and, you know, and stay connected. You talked about the importance of that and really reaching out to our loved ones, neighbors, family. It's just so incredibly important during this time.
Absolutely, certainly. And, you know, that sort of preludes us to Dr. Harsuni. Children, in terms of going in person to school versus the virtual school issue. Now with this new situation and knowing that children are, you know, very susceptible to this virus and this new variant, you know, what is the medical community's suggestion and what are they requesting in regards to school for children, whether, you know, whether it's virtual, whether it's in person, of course, with precautions, but, you know, with all precautions, you know, there's definitely risks. So what is the medical community advising these parents who, you know, are sort of lost and not knowing what to do and what's best for their children?
Right. So it's all about risk versus benefit in this situation. And the medical community is actually, at least for the pediatric community, we are pro-school, in school, not virtual. Unfortunately, through my practice, I am seeing a lot of kids declining in their academic performance, and not many are doing well. And it's not just academic, you know, it's a lot of social, it's a lot of psychiatric, mental health decline as well. So I think the benefit to having school is actually a big plus. I also want to mention that the MIS-C, I know it sounds scary, it's still rare. It's we are seeing it in about 1% of the kids who are getting affected. Something, you know, shadowing what Dr. DeCrube initially said, he doesn't want to see any deaths. I don't want to see any kids affected with this, which is why, you know, I'm really afraid of this virus. But in terms of the benefits to going to school, I think it's a huge plus in terms of, you know, what's going on in our society today and what we're seeing firsthand. Even our therapy facilities right now are at max. A lot of them are turning away children because they just don't have the resources. So that's something very, very alarming. And I think virtual school has a big impact of why that's happening.
Absolutely. And of course, you know, mental health of our kids is going to be affected. We don't know what we're going to see after coming out of this pandemic. So Dr. DeCrube, in stating that our president is actually saying by the end of the summer, we should have some resemblance, a little bit of resemblance of normalcy within our society. How realistic is this scenario? I mean, we're saying, you know, there are still people out there that refuse to wear masks. You know, the message is, you know, you have to wear masks, you have to get vaccinated regardless of, you know, who, what, where, you know, social distancing still needs to be applied. But how realistic is it of us as a nation to think that we can see some normalcy by the end of the summer, given all those different variables?
I think it's very hard. I think this is an excellent question that you just posed right here. You know, to see some sense of normalcy by the end of summer or by the beginning of summer, it's going to be very hard. You have a lot of people, as you said, resisting to be vaccinated, you know, because of side effects. You don't know how many times during the day I get the question, should I get the vaccine? Am I going to get sick? Is this going to affect me? Am I going to die? This is every single day. I have the same questions from so many people, whether in a hospital, in my clinic, whatever I am, in a social event or something like that. I want to tell you something. To start with, a lot of people right now are suffering from something called long haulers. So what is long haulers? Long haulers are people who are having symptoms for months to come, from COVID. So they get COVID and then they start having symptoms, whether it is aches and pains, whether it is, shortness of breath, multiple stuff that for months to come. And there was a lot of evidence that shows that vaccinating those long haulers does help with their symptoms and does help to prevent or to get rid of them being long haulers. So that is something, a benefit from the vaccine. And my fellow people from FLCCC, the frontline COVID-19 critical care workers, shows that this does help with the long haulers. That's number one. Number two, also, I want to give advice to people. If you're afraid to get vaccinated and you just want to get one shot, no, do get the second shot. You can space it out. You can take longer time before you can get your second shot if you are afraid that much. This does help to ease up the symptoms of the second shot, because a lot of people are telling you, oh, I'm being sick, I'm having this symptom, that symptoms from getting the second shot. So I tell them, if you're afraid from the second shot, you can space it a little bit more, but do get it. Don't stop, don't stop at the first shot, because it will not protect you. But I think realistically speaking, the end of summer is still too early if we continue with the same mentality as refusing the vaccines, not doing what we're supposed to be, wearing masks, washing hands, putting hand sanitizer, stuff like that. I think it's going to take a little bit more. By the end of the second wave, we said, okay, we might not have a third wave. I think we're good. I think everybody's getting vaccinated, all this stuff. And look, we're in the middle of a third wave. A lot of people are sick. Hospitals are full, and some people died. So I would take this with a grain of salt. We have to get everybody vaccinated. I would say 80% or more of the United States need to be vaccinated, and to reach a gold number, or we need at least 90%. And I think we should be okay after that. But until that time, we have to practice caution, caution, caution. No other way around.
Very well said. Very well said. Dr. Amran, so many individuals have not addressed their underlying conditions, heart issues, kidney issues, whatever it may be. Now, does that, for obvious reasons, of course, but how does that put them more at risk in regards to contracting COVID and making sure that their overlying health is in shape so they don't have an increased risk of contracting COVID? And if they did, having it be more of a serious situation. So what are we seeing in regards to that?
So if we look at the comorbid people, that they have more tendency to be infected severely with COVID, they really classified it clearly by CDC and everybody, every provider. For example, diabetes, asthma, COPD, heart disease, smoker, obese patient, they all very high risk patient. They may have that high blood pressure, they may have diabetes, they're not aware of that, but this is the reason, back to your first question, please go to your provider as regular basis, don't be scared, put your mask on, keep the social distance, and visit your PCP. He's your guidance. He's the one who's gonna guide you what to do. So we don't know who's really infected right now, or who's carrying the COVID and he had diabetes and he was not diagnosed because they're not going to the doctor. So going to your primary care doctor, visiting him, it's really had to be done on a regular basis. Don't ignore the fact that you need your annual visit. Don't ignore the fact that you need your screening, colon cancer screening, mammogram, your pap smear. That's all have to be done on a regular basis. Whatsoever is the situation, all the clinic, all the provider, all the health center, they are all guided by the CDC to make sure that our patient is protected, and we're following the guideline. So how do we know if they don't come and visit us? They have to go to their doctor. So regular visit to your doctor, don't miss it. If you need to review your medication, go to your primary care doctor. If any other issue happening lately, don't mix it with the COVID-19. You got sick, you may got the flu with the COVID-19. You may get asthma attack with the COVID-19. Don't mix this stuff. Always go back to your primary care physician, address your new symptoms. If you're not able to go physically, telemedicine is available. Now, by the way, we just we relaunched our post COVID-19 post-discharge clinic Monday through Saturday. I don't know, Tanita know about that. So after they got discharged from the hospital, we can monitor them and make sure within the first week their symptoms is getting better and they are on the right track. We need to monitor them also for the post-COVID-19 syndrome, which is persisting of the symptoms and 4 weeks after getting the first symptoms when infection happened. So always the primary care physician, your own doctor, your family practice doctor is there for you. Please seek your doctor attention if any symptom that's really beyond the COVID-19 symptoms.
Absolutely, and so preventative care is really vital to stay protected, as well as the telehealth has been, I think, very, very golden during this time, but in-person visits are extremely important. I know we do have some questions from our audience. One of them is regarding fertility, and it says that it might happen because are the rumors true that fertility is affected if someone were to take the COVID-19 vaccine? I guess, Dr. DeCruz, that might be something that you would answer.
Yeah, there's no like studies out there to tell you 100% that this fertility is affected or not. But from what we see and from what we are, experiencing, I don't think fertility is affected at this point in time. Again, long-term studies need to be done in case you want to study it really scientifically. But from what we have at with working every day with patients, I can tell you it's not a problem. And remember, one thing I want to say: pregnant women are at a much higher risk of death from COVID-19 if they're not vaccinated. So that's something we see. I unfortunately had to deal with a few women that ended up on ECMO that were pregnant and were not vaccinated. So we know that mortality rate is much higher for pregnant women who are not vaccinated. Like mortality rate is up to 80% for pregnant women who get influenza A or B. Same thing is for COVID-19, same type of virus, which is also more aggressive. So that is something I strongly encourage for women who are getting pregnant to get vaccinated because of what's known to happen later on in case, God forbid, they catch COVID-19.
So again, risks benefits.
Absolutely.
Dr. Harsuni, there's a question about my kids are in elementary school and they're on the computer all day learning and they have a hard time sleeping at night. Is it safe to give them melatonin?
Yes, melatonin is safe. Just be careful for long term. There can be an effect with hormones, but that's made later, talking about taking it for many years. But if through this hard time, it's perfectly safe to take it for a few months, just hopefully, especially to get through the school year.
Wonderful. And there's a question here that says, my parents are older, they have heart disease and diabetics. Is it safe for them to take the vaccine? And obviously through our discussion, not only is it safe, it's absolutely necessary to ensure their safety and to make sure that they don't get very, very ill in regards to the COVID vaccine. Is there any additional suggestions, any statements that you'd like to make prior to us closing for the day? Are there any more questions at all?
Well, I have a question in here from a patient. I would like Dr. DeCruz to support me with my feedback. She's saying that she had her first dose and then she tested positive 1 month after she got the first shot, okay? And she went to her provider and he said, no, you can't take it. You can't get the second one. And another opinion was to delay. So I'm not, I mean, the way I could approach that by asking this patient if she had any active symptoms. Does she have symptoms right now or she's not symptomatic? I mean, she got positive. We don't know if she was positive before the first dose or she got positive after the shot. So how do you approach that patient? I told them, if you're not symptomatic, go and get the shot. I mean, just get vaccinated, be on safe side, let your body react. Let your body react to that vaccine in case you got reinfected. Your body gonna be ready for that reinfection. So what do you think about that?
Okay, so Dr. Amran, I want to tell you this: if somebody tests positive after the first shot and they're completely asymptomatic, for several days, there's no problem in getting the second shot. However, if somebody gets symptomatic, fever, chills, cough, shortness of breath, all this good stuff, I would say delay by a month. So we do delay by 30 days, and this will help build immunity, and at the same time, it will be like a booster. So they got the actual COVID. I would delay a month and still give them the second shot, which is, I think, is a must. And I'm telling you from now, this is for everybody watching: diabetics, kidney problems, heart failure, any issues should not be a hindrance to get the vaccine. The only time I wouldn't give the vaccination, somebody has severe allergies. That by what I mean by that is they have to carry EpiPen everywhere. Somebody has to carry EpiPen everywhere, then it's something we have to worry about. If somebody has chronic thrombocytopenia, like very low platelet, I wouldn't take it. I would have to watch very carefully before I give the vaccine. But other than that, I think everybody can get vaccinated, and everybody should be vaccinated.
Dr. Dakru, what about breastfeeding mothers?
Absolutely, they need to get vaccinated. In my book, breastfeeding mothers, pregnant women, anybody who can get the vaccine should get the vaccine, unless contraindicated by their physician, and all the physicians know what the guidelines and how to go about, cohorting these patients.
And I want to add, you can pass along some antibodies through the breast milk to the baby. So it's very recommended.
Yes, I have heard that. Absolutely. Mona, did you have?
Yes, I have two things actually. Thank you. Access on Friday will be hosting a Ramadan night vaccine clinic at 6450 Maple Street in Dearborn. From 9 p.m. to 12 a.m. This will be our second event. Again, what we saw is an amazing turnout. We had over 400 people during our first event that came out. And what we learned is that, it was an opportunity for families that were fasting, people who work long hours that couldn't find an appointment, and also families with young children. So we found that that was an opportunity to encourage people to come out and get vaccinated. So love to have people come out. We're going to be there. And if anyone has any questions regarding the event, to call 313-216-2200. My last just comment around vaccinations and the importance of getting vaccinated. Again, we hear a lot about it being a personal choice, which it is. But what we need to understand is the consequences that come with that choice, and the possibility that if you're not going to get vaccinated, most likely you're going to get COVID. And if you get COVID, you're likely to infect 10 to 15 people. And if 10 or 15 people, if one of those are immune compromised or at high risk, they can potentially die. So we have to think about this, and we have to think about it seriously. And, these are the conversations, and we have to stick to the facts. And the facts right now are, we in the state of Michigan, we have 153,000 positive cases. We have over 4,500 deaths. And now with the new variant that Dr. Tagroob was talking about, we have over 3,400 new cases. And the new variant is showing to be very contagious, and the reaction to the COVID and the side effects seem to be more severe from what we are seeing, in a longer recovery time.
Thank you, Mona. It's definitely a conversation that we can continue, but Ali gave me the okay to go over for just a few seconds. So I want really quickly, Dr. DeCrube, in regards to the vaccinations, people are getting vaccinated first and number 1 and number 2. So are they fully protected? Can they feel comfortable, going out, and of course, still wearing the mask? But in terms of long-term, do you see another booster coming?
Absolutely, there is another booster coming. That's for sure. Between Moderna and Pfizer, I think there's another booster in the works. I think yes, people who are fully vaccinated can go out, still practice caution because of the variant that are out there. You have to be careful. Always, wearing a mask around the crowd if you can. Vaccination will protect you even if you get sick, and I see it in the hospital all the time. People that are sick but they're vaccinated, they're recovering quickly and they're doing well. And I would like to add one thing. I would like to thank Access for their tireless work, and especially Mona Makki. I know how hard she's working during this COVID pandemic, and kudos to her. We love Access, and I myself got vaccinated at Access. I refused to get it at Beaumont. I got vaccinated at Access. That's how much I love Access. And I know they're doing a great work with the leadership of Mona Makki.
Thank you,
Absolutely. She's all our she-hero. She really is, right on the front lines, and can't say
we cannot do this without everyone's effort. Dr. DeCrube is someone who is a part of the Access family for a very long time. We haven't seen him in the last few months because we know he's busy. But he's someone that we admire and are very, very grateful for his work at our medical center. And also Ali, I'm proud to say that he is on my team at Access. Siham, you're a part of the family for forever. And the rest of you on this call, I can't wait to get to know you more and to work with you. And you're already part of the Access family. And Access could not do this work without, the love and the support that we have seen in our community. Really, our community is shining when it comes to standing up and helping out each other and making sure that we are safe. So I cannot thank all of you in our community for all the support that we have received.
Thank you, Mona. Thank you. Dr. Hassan DeCrube, thank you so much. Your knowledge and your information is so valuable to all of us. Dr. Amal Omran, thank you for being with us, and thank you for your perspective. Dr. Radha Harsuni, thank you. And thank you for taking care of all our kids. We really appreciate you. Mona, you are a she-hero. What can I tell you? Thank you for everything you do. You're right on the front lines. I mean, you put your, take your sleeves up and you get to work. So thank you for everything that you do. Thank you all for joining us today, and hope that you have taken away some valuable information that will assist you in actually making the right choices for you and your family and your community. We're really in this together. The safety of all really relies on the safety of each and every one of us. We must take this seriously. We need to work together so we can eradicate this virus. And it's time we hug our families and we see our loved ones. Let's collectively make that happen by continuing to wear our masks, to social distance, and vaccinate. Number 1 and number 2, and also to make sure that we take care of our underlying conditions and go to that doctor, make that doctor's appointment to make sure that if we do contract COVID, that we are physically capable of going forward. Thank you to our partners, Access, the DMC, the wonderful Tanita Chapman. Thank you so much for really helping and helping put this panel together. We really appreciate you. And to the Dearborn Lions Club team who worked diligently to present today's panel discussion. I am a proud member. I'm proud to be a Lion, and also encourage anyone who wants to serve their community in a meaningful way to consider joining the Lions Club in Dearborn or within your own community. It's certainly it's a worthwhile organization. Thank you, President Lion Ali and Lion Fatmi Mustafa, for all your dedication to this presentation, and also to the Lions Club. We will also be having another panel discussion on May 18th with our faith-based community, speaking about COVID-19 and their perspective. So thank you all for joining us. Please enjoy this upcoming video with a vital message from our DMC partner as well. Have a good evening. Please stay safe and God bless.
Hello, I am Dr. Audrey Gregory, CEO of the Detroit Medical Center. As we know, the COVID-19 pandemic has had a devastating impact on our community, especially on people of color. COVID-19 has disproportionately impacted communities of color throughout our state and across the country. That is why it is so important for us to get the COVID-19 vaccine. I realize that some of you may be concerned about getting the vaccine, and I understand. I encourage you to trust the science and recognize that we now have a valuable tool in the fight against the virus. COVID-19 vaccines have shown to be safe and highly effective at preventing the virus. Being vaccinated for COVID-19 may help keep you from getting seriously ill, even if you do get the virus, and could also help to protect your friends and family members. I hope that you find this video helpful in your decision-making. I also ask that if you can, please feel free to share this information with others in your sphere of influence. I wish you and your family good health, and thank you for your support of the DMC.
2020, 2021, we're looking at the COVID crisis. What does that mean? That means people are dying from this COVID. The people that are affected more are people of color, people that have lower socioeconomic status. There's disparity in terms of income, in terms of access to care.
The reason vaccines are so important is that Afro-Americans and Latinos have a 3 times higher death rate than the rest of the population. We finally have a tool to fight this virus. And if we can get 70 to 85% of our population vaccinated, the disease will go away.
Historically, the African American community does not trust the healthcare system. So to combat any hesitation that someone may have in getting the vaccine because of this mistrust, I decided to get the vaccine early. I did this not only for myself, but to show my community, friends, family, patients, other staff members in the hospital that it was safe to get the vaccine.
We have to open up the city, the country, the world. We have to open up our businesses such as restaurants, fitness centers, athletic arenas. We have to open up our homes to our friends and family so we can sit around a table and eat.
You got to get the vaccine, and that all of the things that have happened in the past, all of the dynamics that led to us doing poorly during the virus, the social determinants of health, the structural racism, all of that being said, we still need to be at the beginning of the line when it comes to getting this vaccine.
We're going to defeat this virus, but it's going to take Black professionals encouraging Black people to do it.
Thank you, DMC. Thank you all for joining us. And please remember, you're doing it for your families. You're doing it for your friends. You're doing it for the state and the world. We need to get vaccinated. 98% coverage from COVID-19 with vaccinations. Don't be afraid. It's so much better than the alternative. God bless. Please stay safe and make that appointment to get vaccinated. And thank you all panelists for being with us today. We really appreciate your knowledge and your input. And thank you to the Dear Friends Club. Bye-bye, everyone.
Thank you.
Bye, thank you.